A ticking time bomb. Why heart disease still rules. Every 36 seconds, someone dies from cardiovascular disease. That's more than 17 million lives lost each year around the world. What's driving this? Often, the cause is silent and deadly. It's something called high LDL cholesterol. LDL stands for low-density lipoprotein. It's often called bad cholesterol. Why? Because it builds up inside your arteries as plaque, clogging them, narrowing them, and making them less flexible. There are usually no symptoms, no warning signs. Then suddenly, a heart attack or a stroke. But here's the good news. Modern medicine has a powerful way to fight back. It's called a statin. Statins have transformed how we prevent heart attacks, strokes, and early death. Statins explained how cholesterol-lowering pills prevent heart attacks and save lives, but to beat heart disease, we must understand what we're really up against. Let's break down the science behind cholesterol. Meet the molecule. What are statins? Let's break it down. Statins are a group of medications designed to lower LDL cholesterol in your bloodstream. Remember, LDL is the type of cholesterol that can build up in your arteries and cause dangerous blockages. Statins belong to a class of drugs called HMG-CoA reductase inhibitors. That sounds complicated, but here's what it means. Inside your liver, there's a special enzyme called HMG-CoA reductase. This enzyme plays a key role in making cholesterol. Statins block this enzyme, so your liver can't produce as much cholesterol. But why is that important? Because most of the cholesterol in your body is actually made by your own liver, not from food. So if you block cholesterol at the source, your total LDL levels start to drop. And there's more. When your liver senses it's making less cholesterol, it responds by pulling more LDL cholesterol out of your blood, using special receptors. That means cleaner, wider arteries, and a lower chance of heart attacks or strokes. Statins block cholesterol production, but how do they trigger this chain reaction inside your liver? Let's zoom in and explore the fascinating biochemistry behind how statins work at the cellular level. Biochemistry made simple. How statins lower cholesterol. Let's dive deeper to how statins work inside your liver cells. Statins block an enzyme called HMG-CoA reductase, the gatekeeper of cholesterol production. When this enzyme is blocked, your liver makes less cholesterol. Then, your liver responds by activating more LDL receptors, special protein docks that pull LDL cholesterol out of your bloodstream. This two-step process lowers your blood LDL levels, helping clear your arteries and reduce heart risk. Now, not all statins are the same. They differ in how strong they are, how long they last in your body, and how they behave chemically. Here's a quick overview of the most commonly prescribed statins. Atorvastatin Lipitor, a lipophilic or fat-loving statin. It's very strong and lasts a long time, so you can take it any time of day. Simvastatin Zocor, also lipophilic, but less strong, usually taken at night because it's shorter acting. Rosuvastatin Crestor, a hydrophilic, water-loving statin. It's very potent and liver-specific, which may reduce muscle side effects. Pravastatin Pravachol, hydrophilic and moderate strength, often chosen for patients who have side effects with other statins. Lovastatin Mevacor, lipophilic and similar to simvastatin, taken mostly at night. Fluvastatin Lesgol, less potent, lipophilic, and usually for mild to moderate cholesterol issues. The chemical nature, lipophilic versus hydrophilic, affects where the statin goes in your body and the likelihood of side effects. Lowering cholesterol is just a start. Statins also fight artery inflammation, a hidden threat you need to know about. Let's explore that next. Beyond cholesterol, statins fight inflammation too. Did you know that most heart attacks happen not just because of cholesterol buildup, but because of inflamed plaques inside your arteries? Plaques are fatty deposits, but when they become inflamed, they become unstable. This instability can cause plaques to rupture suddenly, which blocks blood flow and leads to a heart attack or stroke. Statins do more than just lower cholesterol. They also reduce inflammation in your artery walls. One way they do this is by lowering the levels of C-reactive protein, or CRP for short. CRP is a protein found in the blood that signals the presence of inflammation throughout your body. When CRP levels go down, it means your inflammation is reducing, and your artery plaques become more stable and less likely to rupture. Statins also improve endothelial function. The endothelium is the thin lining inside your blood vessels. It controls how well your vessels relax and contract to keep blood flowing smoothly. When endothelial function improves, your blood vessels become more flexible and healthier. Simply put, statins help your arteries stay strong, flexible, and less likely to cause dangerous blockages. Reducing inflammation is crucial, but do statins actually lower the risk of heart attacks and strokes? Let's look at what the science reveals. What studies say, proof that statins save lives. Extensive clinical trials have proven statins' effectiveness in reducing heart attacks, strokes, and death. One landmark study called the 4S trial showed that statins reduced the risk of heart attacks by about 35% in patients with existing heart disease. Another important study, the Jupiter trial, demonstrated that statins lowered cardiovascular events by 44% even in people whose LDL cholesterol was normal but had high levels of C-reactive protein mean. And they had inflammation. More recently, a large review published in The Lancet in 2020 to combine data from many studies, it found that for every 1 millimole per liter reduction in LDL cholesterol, there was a corresponding 20% reduction in major heart-related events. These results show that lowering LDL cholesterol with statins is not just about numbers on a lab test. It truly translates into fewer heart attacks and longer lives. Statins clearly help prevent heart disease, but are they safe for everyone? Let's take a closer look at common side effects and rare risks. Common and mild side effects of statins. Most people who take statins tolerate them well without serious problems. The most frequent side effect reported is mild muscle pain or stiffness. This affects about 1 in 10 people. Usually, this feels like mild soreness, cramps, or weakness in muscles. Fortunately, these symptoms often improve if your doctor lowers the dose or switches you to a different statin. Other mild side effects may include digestive issues like nausea or constipation, as well as mild headaches or dizziness. These symptoms are generally temporary and manageable. If you notice any new or persistent symptoms while on statins, it's important to communicate with your healthcare provider. They can adjust your treatment to keep you safe and comfortable. While most side effects are mild, some rare reactions need urgent medical attention. Here's what to watch for: rare but serious risks. What you must know about statins. While most people tolerate statins well, some rare side effects can be serious and require immediate medical attention. One of the most serious is rhabdomyolysis, a condition where muscle tissue breaks down rapidly. When this happens, proteins from the damaged muscles enter the bloodstream and can harm your kidneys. Fortunately, rhabdomyolysis is extremely rare. It occurs in fewer than 1 in 10,000 people taking statins, but it is important to recognize the warning signs, which include severe muscle pain or weakness, much worse than mild soreness, dark or cola-colored urine, extreme fatigue or weakness. If you notice any of these symptoms, seek medical care immediately. Statins can also cause an increase in liver enzymes, which may indicate stress or damage to the liver. That is why doctors regularly check liver function with blood tests during treatment. Additionally, statins carry a small increased risk of developing type 2 diabetes, especially in people already prone to it. However, for most people, the protective benefits of statins against heart disease far outweigh this risk. Now that we understand the risks, let's answer the big question: who actually needs to take a statin? Who should take statins? Statins are not prescribed to everyone. Instead, doctors recommend them for people who have clear, measurable risk factors for heart disease. First, statins are strongly advised for anyone with existing atherosclerotic cardiovascular disease. That means people who have already had a heart attack, stroke, or other conditions caused by artery plaque buildup. Second, people with very high LDL cholesterol levels, specifically above 190 milligrams per deciliter, are usually prescribed statins. Such high LDL is dangerous and significantly increases heart disease risk. Third, statins are recommended for people aged 40 to 75 years who have diabetes, especially if they have additional risk factors like smoking or high blood pressure. Finally, doctors use tools like the atherosclerotic cardiovascular disease (ASCVD) risk calculator to estimate a person's 10-year risk of heart disease. If this risk is 7.5% or higher, statin treatment is often recommended to reduce future problems. Your healthcare provider will evaluate your individual situation carefully, using blood tests and risk scores, to decide if statins are right for you. Taking statins can save lives, but timing matters. When is the best time to take your statin? Let's find out. Best time to take statins: when you take your statin matters, especially for short-acting types. Most statins work best when taken at night. Why? Because your liver naturally produces the most cholesterol while you sleep, especially between midnight and early morning. Short-acting statins like simvastatin are more effective when taken in the evening, so they're active during the liver's peak cholesterol production. However, some statins, like atorvastatin and rosuvastatin, stay in your system longer. These are called long-acting statins, and they can be taken at any time of day. But here's the most important rule: take your statin consistently, at the same time every day. To keep cholesterol levels stable and maintain full protection, statins plus lifestyle. Maximum benefit: statins are powerful, but they work best when combined with a healthy lifestyle. First, eat a heart-healthy diet. That means more vegetables, fruits, whole grains, and healthy fats like olive oil and nuts. Cut back on fried foods, red meat, and added sugars. Next, stay active. Aim for at least 150 minutes of moderate exercise every week. Even walking, cycling, or dancing can help your heart and cholesterol. Avoid smoking completely. It damages blood vessels and increases heart disease, even if your cholesterol is low. Also, manage your stress. Deep breathing, yoga, and quiet time all help lower inflammation and blood pressure. And don't skip your checkups. Your doctor will monitor your cholesterol, liver function, and any side effects through blood tests. This helps keep your treatment safe and effective. Statins work best when they're part of a bigger plan, not a magic pill, but a powerful tool with the right habits. Busting myths about statins. Let's clear up some common misconceptions with science. 1. Statins damage your liver. Truth: serious liver damage is extremely rare. Statins may cause small changes in liver enzymes, but true liver injury is uncommon and usually reversible if caught early with routine blood tests. 2. You don't need statins if you eat healthy. Truth: a good diet helps, but it's not always enough. Many people have genetic factors that cause high cholesterol, no matter how healthy they eat. 3. Statins always cause muscle pain. Truth: most people on statins don't experience any muscle pain. When symptoms do happen, they're usually mild and can often be managed by switching statins or adjusting the dose. Alternatives to statins: if you're unable to take statins due to side effects or intolerance, don't worry, there are other effective options to lower LDL cholesterol. First, there's ezetimibe, a pill that works by blocking cholesterol absorption in your intestines. It's often used alongside a low-dose statin or by itself in sensitive patients. Second, we have PCSK9 inhibitors, powerful injectable medications. These drugs help your liver remove more LDL cholesterol by increasing the number of active LDL receptors. They can reduce LDL levels by up to 60%. These are usually prescribed for people with very high risk or familial hypercholesterolemia, a genetic condition that causes dangerously high LDL. Third, there's bempedoic acid, a newer oral medication that lowers cholesterol using a different pathway from statins. It's especially useful in people who can't tolerate statins at all. These therapies aren't for everyone. They're typically reserved for people with high risk, severe cholesterol issues, or clear statin intolerance. But they show that modern medicine is more than one way to protect your heart. So where does this leave you? Let's wrap up with what you need to know and how to take action for your heart health. Final thoughts: science meets self-care. Statins are one of the most studied medications in history. They lower LDL cholesterol, reduce inflammation, prevent heart attacks and strokes, and help people live longer. But remember, statins are not a free pass. They work best when you take care of your health in other ways. 2. Ask questions. Understand your cholesterol numbers. Go to your follow-up appointments. Take your statin at the same time every day. Eat healthy, stay active, and manage your stress. When you combine science with your daily habits, you give your heart the best chance to stay strong. Thanks for watching PharmaconHealth, where science meets self-care. If you found this video helpful, please like, share, and subscribe to support the channel. We're here to bring you science-based health information you can trust. Most importantly, talk to your doctor about your heart health. Ask about your cholesterol numbers. Find out if statins might be right for you. Together with your healthcare provider, you can make informed choices and build a healthier future. Thanks for watching.